nurses webinars, members of a Hellenic regulatory body of nurses. Asthma. How do I know if my child has asthma? What is asthma? What are the causes? What are the symptoms? When should we worry? These are some common questions we all have about asthma. What is asthma? Asthma is a disease that affects your lungs. It is the most long-term disease of children, but adults have asthma too. Asthma is a chronic inflammation of the airways that causes narrowing, constriction of the airways, and the result is difficult breathing. Asthma affects the smaller airways bronchioles of the lungs. The first and most important factor causing narrowing of bronchial tubes is inflammation. The second factor is bronchospasm and hypersensitivity. Breathing difficulty in lungs may cause lack of oxygen, breathlessness. This breathing difficulty for the air to pass from the airways to lungs causes a wheezing sound like small kitten, as children usually say, coughing, chest tightness, breathlessness, especially at night. The inflammation irritates the muscles around the airways and causes them to squeeze, constrict. This causes narrowing of the airways. It's more difficult then for the air to get in and out of the lungs. This leads to wheezing and breathlessness. The mucus clogs the airways and further blocks the flow of air. This is called an asthma attack. Both the frequency and the severity of asthma symptoms can be reduced by the use of medication and by reducing exposure to the environment triggers of asthma attack. Statistics. About 20 million Americans have asthma and approximately 300 million people worldwide. Nearly 7 million are children. Many children outgrow asthma in their 10 years. Each year, 5,000 children die from asthma. How do I know if I am allergic and to what? If you belong to people who suffer from allergies, asthma, rhinitis, conjunctivitis, hives and other general reactions, without knowing what allergen causes this, is it food or plants or insects, maybe medicine, you can make some tests. There are some tests that someone can do and find out if he is allergic. These tests, called tests for allergens, you may ask a doctor, an allergist. So, if someone in your family or near relative suffers from asthma or allergies, you may have inherited a tendency to be allergic, and your chances of developing asthma are greater than average. Or it can be caused from from external factors, the allergens or unknown cause. What causes asthma? Here I have a small table and have collected all the causes of asthma. Let's see them one by one. One cause of asthma is flu, cold, infections, fatigue, intense exercise, walking, climbing stairs, sports, swimming, the weather, of course, cold, damp, windy, stormy weather, sudden temperature changes, wind, trees, grass, air pollution, smog, fumes, cigarettes, dust, fumes, house dust mites causes allergies and then asthma follows. Home detergents, chemicals, cleaning supplies, scented candles, hairspray, personal care products. Animals, hair, feathers, birds, animals with fur as cats, dogs, ferrets, guinea pigs, bunnies, or mice. The intense emotional states, of course, laughing, stress, anger, fear, yelling, crying. Another cause of asthma is allergies. Allergens like house dust mites, cats, dogs, pollen of flowers in spring, cockroaches, yes, cockroaches also. Inheritance, it's very important. Mold can trigger your asthma symptoms. Perfumes, sulfites, food preservatives in foods, yes. Occupational asthma. For example, flour can cause asthma in bakery suffers. Good dust in carpenters, paint colors, etc. Dry mucus in in the lungs. Here is a poster designed for asthma. You may see here the collection of causes: flu, infections, walk, run, up and down stairs, gymnastic, swimming. Asthma causes pollen of flowers, animals, hair, feather, home detergents, personal care products, dust, fumes, home dust mites, smoking, and scented candles. What are the symptoms of asthma? You may have shortness of breath, wheezing, coughing with mucus, coughing frequently when running or playing, breathing difficulty, breathing becomes rapid, dry mucus in the lungs, trouble sleeping, chest pain or brightness. Chest pain or tightness, sorry. Forgive my English. Types of emergency. If you take your medicines about asthma, and the medicine does not relieve your symptoms, it is a sign of emergency. Your peak flow meters show low levels of air after treatment. Your fingernails or lips turn blue or gray. You have difficulty breathing. Your neck, chest, or ribs are pulled in with each breath. Your nostrils flare when you breathe. Your heartbeat is rapid. Treatment. Asthma cannot be cured completely if the cause is unknown, but someone can control asthma and he will be able to reduce symptoms and to live an active and normal life. Treatment is usually with inhalers. If asthma occurs in an early age, usually in childhood to 14 years, it can be treated significantly. Asthma is not lethal, but it needs proper treatment and care. When many of the symptoms mentioned above are present, then we talk about asthma. Most asthma medications work by relaxing bronchospasm, bronchodilators, or reducing inflammation, corticosteroids. The medication used to treat asthma are divided into relievers or short-acting bronchodilators. Are those medicines which used on acute asthma attack and seek immediate relief to the patient from difficulty breathing. These medicines help to avoid becoming worst symptoms. They act quickly and open airways to pass air into the lungs. And second is preventive medicine or otherwise long-acting, have effects that last long time. They should not be used for quick relief. This type of treatment is used to prevent a new crisis. The bronchodilator drugs work in muscles surrounding the bronchi, causing relaxation of these and thus open up the blocked airway. Prevention. How can we prevent acute asthma attack? How to prevent asthma from becoming chronic? If we understand the cause of asthma and strike at root, this may reduce asthma significantly, and not just to talk about medication, but also for simple everyday things that everyone ought to do, like the cleanliness of the area daily living, our home. First of all, let's reduce allergens. Automatically we reduce one of the causes. For example, clean often your house, the place we live every day. Clean sofas, clean carpets, mop the house, change the sheets of beds, cover mattresses and pillows in airtight covers. If we can afford, we may change sometimes the mattresses of beds. With this way, we avoid mites that are alive microorganisms living in our dust in our home. If you must have carpet, you can treat it with chemicals to help reduce dust mites. Caution with chemicals also. Try to avoid stuffed animals, dried flowers, and other things that trap dust. We protect ourselves and our children from cold weather. When we understand that something caused more dyspnea, breathing difficulty, at work, at play, in general physical activity, in the gym, at school, then we need to take some rest. You can help avoid asthma attacks by avoiding the triggers, also called allergens, and irritants that can start an asthma attack. Triggers and irritants vary for each individual, but the following are some examples of common triggers and irritants. Strike causes step by step. Strike causes one by one. In the root. First, protect yourself from cold. Wash your hands regularly to prevent infections. Keep a meter in exercise. Be careful. When asthma occurs, you should take some rest. A meter in exercise, in walking, in sports, swimming. Do not visit usually areas with stormy weather, wind, stormy, humidity, especially mountainous areas, changes in weather. Be careful. Stop smoking. Avoid places with dust, fumes, air pollution. If you live in capital, it is difficult. Avoid animals with fur like cats, dogs, bunnies. Clean your house daily. Clean your carpets, change bed sheets and wash them in high temperatures. If you can afford, change the mattresses of beds. This way reduces dust mites and allergies. Avoid chemicals with intense smell. Be careful not breathe the floor, dust, etc. You may wear a mask. Avoid intense emotional status. Use only friendly perfumes, but it's better to avoid them. Clean the house, the bathrooms, close the windows of car, from house, mold. Caution in spring with pollen of flowers. Make tests for allergens so to understand in which allergens you are sensitive and just avoid your trigger that causes your asthma. Allergies. Allergens, house dust mites, cats, dogs, pollen of flowers in spring. Avoid that kind of food. Sulfites, food preservatives in foods inherent wine, beer, salad, bars, dehydrated soups and other foods. Ask your doctor only with medicine therapy. Don't forget to do allergen tests to find out in which allergens you are sensitive, and spirometry. Spirometry measures how much air you can blow out into a machine called a spirometer. Don't forget to use peak flow meter. Peak flow meter is a portable device used to measure how air flows from your lungs quick or measures how peak expiratory flow rate or measures your peak expiratory flow rate, PEFR. With this small portable machine you can measure your ability to push air from your lungs. This is a simple machine. Ask a doctor or a nurse how to use it properly. It measures the speed that you can blow out of your lungs. If your airways are narrowed, your peak flow reading will be lower than expected for your age and sex. If you have untreated asthma, then you will normally have low and variable peak flow readings. Measuring your peak regularly can help you tell whether your asthma is getting worse. Don't forget regular monitoring by a doctor.